So the Greater Manchester Care Record is a database that contains health and social care data of all people living in Greater Manchester. So the primary purpose of the care record is to allow care providers to see data from patients who were treated elsewhere, for instance, and that they are now seeing. But there's also secondary uses of the same data, and one of them is research, and that's where I come in. So I lead on the use of the Greater Manchester Care Record for research.
Whereas a clinician, we can see into the individual patient's record to try and improve their care. As a researcher, we only have access to completely anonymized data.
We can use that database to answer questions about the Greater Manchester population and its health that we previously were not able to answer and where we basically didn't have any insights into.
The secure data environment is a place that researchers can get access to healthcare data. It's really exciting for researchers because now they'll be able to access a data set about people in Greater Manchester, and then their research can then have a positive impact on the lives of people within Greater Manchester. We've got a number of great projects going on at the moment. For example, we're looking at air pollution and how that affects patient outcomes. We're looking at the effects of long COVID, which is affecting many thousands of patients, and it's still a bit of an unknown quantity. And we're also looking at patients who've survived cancer and their ongoing journey back into primary care and making sure their treatment is as optimized as it can be. So I'm really excited about what we can achieve with this. We're finally getting access to this data, and it can only have positive benefits in terms of the research and the changes to treatment and the effects on the general population.
So nowadays, we've got this massive opportunity, and the Greater Manchester Care Record, I think, is a tremendous example of that, where we actually have the data, and with that, we can make the NHS better. So my vision for the future is that we use the Greater Manchester Care Record and all the other data that we have in the NHS to do exactly that.